Occupational therapists are responsible for providing patients in recovery with the education, rehabilitation, and technology needed to function at the highest level possible. Occupational therapists address the illness, injury, or disability affecting the patient while utilizing the patient's strengths to increase their level of independence within their daily environments.
Hi, my name is Terry Sullivan, and I currently work in an outpatient orthopedic clinic. It's a physician-owned clinic. We have several orthopedic surgeons that work here, along with certified hand therapists, which is a certification that I have, along with being a registered occupational therapist. My role as an OT in an outpatient orthopedic clinic is we often receive referrals from the physicians. That is part of a requirement of our operating license. And so we will get referrals, and then we do go through a process of evaluation. And with that information, we design a rehabilitation plan to help them regain their normal range of motion, their normal strength, and a return to function. So with that, we would provide exercises that they would learn, and we would educate them on the nature of their injury. And the reason for that is oftentimes they are more compliant and realize the importance of the things we want them to do and the things that we don't want them to do that will help them return to their normal function.
Example areas for this role as occupational therapists are as follows: acute care and skilled nursing facilities, assistive technology and devices, brain injuries, cancer, care for patients with spinal cord injuries, chronic disease, community mobility and driving, developmental and intellectual disabilities, hands and upper extremity, health promotion, home modifications, restraint reduction, and stroke.
Individuals with chronic illnesses, injuries, or disabilities, as well as their families and caretakers, are served and impacted by the work of the occupational therapist. Occupational therapists strive for improvement of patient self-care, independence, and functional integration within their environment. When a patient is able to develop a higher level of self-sufficiency, their dependence on others is reduced, which in turn impacts anyone who might normally have shared the responsibility to care for or assist the individual in their normal tasks. It is important to understand that each individual will have a different cultural background. As a practitioner, we need to respect the differences and provide treatment that relates to their personal culture. Examples include Native American beading, eating meals as a family, and participating in holiday gatherings.
Depending on the age, gender, socioeconomic status, and educational level, individuals will have personal feelings regarding abilities and goals. Examples include high school extracurricular activities, attending college, learning vocational skills, and returning to work following an injury.
Refers to the timeline of a person's life. This includes the phases that a person goes through from birth to the end of life, the current time of year, and personal history. Examples include job status, number of years of employment, and transitioning to a new environment.
Technology is ever-changing, but it is important to stay up to date on what is available and popular for all age groups. Examples include personal communication, whether this is through a text message, phone call, or in person, virtual communication, and computer literacy.
The 2017 Centennial Vision states, "We envision that occupational therapy is a powerful, widely recognized, science-driven, and evidence-based profession with a globally connected and diverse workforce meeting society's occupational needs. This is used to secure well-being and enjoy higher quality of life through preventing and overcome obstacles to participate in the activities individuals value. This can be done through occupational therapy by getting those back to their prior level of function and helping individuals with disability to become as functional as possible."